Hello and welcome to Mental Health Playbook, Getting Started. This is the first in a series of 12 sessions designed to provide an entry-level introduction to Part B, billing for outpatient mental health services. Because this is designed for those with less experience, we plan to cover only the advertised mental health topics during this webinar today, and we will answer questions only that pertain to our agenda topics. This avoids confusion for those new learners, and it helps us stay on track for the 60-minute time frame that we have allotted to discuss today's advertised topics. If you have questions on other mental health related topics, I recommend you check out future mental health webinars so that you may plan to attend. As I mentioned, this is the first in a series of 12 sessions. But if you need an immediate response to any question about any topic, including those that we don't plan to discuss today, please give customer service a call and someone will be happy to help you with your question. They'll provide an answer for you. My name is Mary Muko. I am a member of the Provider Outreach and Education team, and I will be your presenter today. Joining me is my friend and colleague, Karen Curtis, and Karen will be working a bit behind the scenes, helping us make certain that we provide you with the information that we agreed to provide to you today. So before getting started, I do want to remind you to review some disclaimers that I have placed at the end of the PowerPoint presentation. There are details in the notes view of slide 35 that you do need to be aware of. The information that we plan to present today is current, but it is subject to change. So we do also ask you to notice the disclaimers, but also refrain from recording any portions of this presentation. We are actually recording this webinar and we will publish it on our Encore Presentations webpage and also on our YouTube channel. If you do not wish to participate in this recording, you may leave the webinar at any time. I do want to mention the CMS Medicare Learning Network, or MLN product, or actually their webpage. It is on the MLN webpage that you can find links to many Medicare learning resources. In their internet-only manual, publication 100-09, the name of that manual is the Medicare Contractor, Beneficiary, and Provider Communications Manual. You can find directives for the customer service program in Chapter 6. And within that section of the internet-only manual are the directions from CMS that WPS and other MACs follow. It states that MACs must use CMS National Education materials like cms.gov or MLN products and the MLN Connects newsletter in their PO activities. So here then is one MLN product that Karen and I will refer to during this and future Mental Health Playbook webinar sessions. It is one titled Medicare and Mental Health Coverage. You can see that I've embedded a link to this publication. Here on this slide, you can see some of the topics that I've taken from the products table of contents listed here on this slide. This is just an example of some of the great information you can find in this MLN booklet. The information here, or this publication, is available to link to, as I mentioned, and we did also mention in our webinar advertisement that we will be referring to this booklet, so if you'd like to, you can download it and follow along during our webinar and in the remaining sessions in this webinar series. Here is the objective and agenda for today's webinar, and just as this shows, today's webinar is designed to provide learners with an entry-level introduction to Medicare Part B, original Medicare outpatient mental health. We will not be discussing during the series any inpatient mental health services. The agenda should look very familiar. The same words that you see here on this slide actually appear in the webinar description. This is what I plan to cover during this webinar session today. So let's begin with a little bit of background or history on the mental health services that original Medicare covers and doesn't cover. This is the first item on our agenda today. I do want to begin by talking about some all-encompassing criteria. Sometimes we call it the overarching criteria for Medicare payment. And this applies not just to mental health services, but for any services that are billed to the Medicare program. It is in Section 1862 A1A of Title 18 of the Social Security Act that states Medicare payment can only be made for services that are medically necessary. So how does Medicare know if a service on a claim is medically necessary? Each claim must include the specific sign, symptom, or patient complaints for each service on that claim. The multi-carrier system, what we call MCS, is the shared system that is used to process Medicare Part B claims for physician care, durable medical equipment, and other outpatient services. And this is a system used nationwide. When a Medicare claim is in process, the MCS, that system, exchanges information between other CMS systems to ensure eligibility and coverage for both the beneficiary and then, of course, the services that are being provided. And it also assures that the provider is eligible to bill for those services. In addition, there are edits and audits that occur during processing that help us assure that the information reporting on that claim aligns with Medicare's medical necessity requirements as required by the Social Security Act. In addition to being medically necessary, items and services must also be what we call otherwise covered by Medicare. And this slide lists some examples of what we mean when we say it has to be otherwise covered by Medicare. Of course, medical necessities, the overarching criteria, but it does also need to meet, or that service, that claim needs to meet other criteria for payment. And some are listed here, these examples. It can't be a duplicate. It must meet all statutory requirements. And what we mean by that is that it must meet any law. It must be submitted by someone who's eligible to bill Medicare. And of course, the service must be rendered or provided to an eligible Medicare beneficiary. Also, the service needs to be correctly coded. And there's more services that would qualify under this category of otherwise covered by Medicare. When you ask me a question, I'll say, well, the service needs to be medically necessary, it needs to be otherwise covered by Medicare, and XYZ. So I just wanted to explain to you, if you hear someone from Medicare say that it needs to be otherwise covered, that's really what we're talking about. So let's take a look then at some examples of some of the services that may be covered by Medicare. This does list examples of what we mean, or some of those services that are covered Medicare Part B services. You can see chronic care management listed here. A couple of years ago, we had an initiative at WPS to promote the use of chronic care management and complex chronic care management codes. So I kind of like to include this in my examples to remind people of how important it is to consider billing those services. Medicare can also cover some screening under mental health. Depression screening, for example, that was another one of our initiatives, alcohol misuse and screening, and so on and so forth. Here are even more examples of Part B services that Medicare can cover. Of course, it needs to be medically necessary, otherwise covered by Medicare, and so on and so forth. Drug therapy, pharmacologic management, psychiatric diagnostic evaluations can be covered by Medicare Part B. You'll see other things listed here: substance use disorder, risk assessment, therapeutic activities, and so on and so forth. Now, CMS does provide a list of behavioral health and wellness services that they may cover, and they do so on pages 5, 6, 7, and 8 of that MLN booklet that I talked about earlier. Difficulties with some reaction time on the system today, so bear with me. I'm going to pull it open and I'll bring it right over onto the slide in just a moment. Here it is. And this then is that MLN booklet that I talked about earlier. We included the link to this booklet in our advertisement for this series because both Karen and I are going to show you this booklet during some of our presentations and point things out to you, things that you might want to come back to later on. And I'm talking about services that are covered by Medicare and not covered by Medicare. I showed you some of the items that were listed here in the table of contents, laid out really nice. You could simply click on any part of that table of contents and go directly to that content. But right now, and I'm pulling it open again, I went too far. There we go, it's the MLN. Here then is the table of contents, and I told you that the services that are covered by Medicare are listed here on page 5, 6, 7, and 8. So a lot of great information there, and one of the things that I love about CMS's publications is that they embed all of these links that you'll see here in blue so that you can quickly go to that reference or resource simply by clicking on the title of it when you see the blue colored font, and then of course it appears as underlined. That means that the information is linked or hyperlinked. So some great information in that booklet. I do recommend that you take some time and look through it. Now, I just talked about those services that Medicare can cover or can consider for payment. Of course, all of the payment guidelines would need to be met. There are also listed in this publication those services that are non-covered mental health services. So I'm switching gears now to talk about some of those services that Medicare does not cover. And I've listed some of them here on this slide for you. You can also find a list of non-covered services in that MLN booklet. It is at the bottom of page 8, so you might want to make a little note of that. Now, I talked about covered services. I talked about non-covered services. I do want to mention, I went too far, I'm sorry about that. I do want to talk about prescription drug coverage. We did advertise that this webinar series focuses on Part B outpatient mental health services. But I do want to mention this prescription drug coverage because it will pertain to some of your mental health patients. So prescription drugs are mostly not covered by Medicare Parts A and B, but Part B can cover some drugs that patients cannot self-administer. It is Medicare Part D that is required to cover some medications that are included in certain mental health treatment drug classes. As indicated here, there are some exceptions. To view which drugs are covered under Medicare Part D, you'll need to refer to the formulary for the particular Part B drug plan. You can usually find these on the drug plan's website or by calling the number on the patient's insurance card. So just a little bit about prescription drug coverage, not covered under Part B or mostly not covered under Part B, but I did want to mention it so you know where to go to get help if you have questions. Similarly, I want to talk a little bit, very briefly, about Medicare Part C or Medicare Advantage. We receive a lot of questions about claims and coverage for those beneficiaries who have elected a Medicare Part C plan, also known as Medicare Advantage. Some people shorten it up and call it MA. Some patients get Part A, Part B, and Part D under a single Medicare Advantage plan, but Part C is not the same as original or traditional Medicare. Part C must cover the same basic benefits as Part B, but Part C can and often does cover more than what original Part B Medicare covers. So WPS is a Part A and Part B Medicare Administrative Contractor. We shorten that up and call it MAC. We process claims only for those beneficiaries who have chosen traditional or original Medicare. We can't answer questions about other insurance plans. This would include Part C or Medicare Advantage plans. You'll need to contact the Part C plan if you have questions as to coverage and payment for services rendered for those beneficiaries who have chosen a Part C plan. And this is exactly why if you call customer service with a question about a claim for a beneficiary who has elected Part C, we're unable to answer that question, and we explain that you need to contact the Part C plan because that patient has elected non-traditional or non-original Medicare. They have elected instead Medicare Part C. The next portion of today's presentation is how to become a Medicare provider. There are 3 steps to becoming a Medicare mental health provider. Within those 3 steps, there are multiple more steps, but these are the 3 main steps that you're going to need to take. The first step to becoming a Medicare mental health Part B provider is really not unlike any other individual who wishes to become a Part B provider. You need to get a national provider identifier or an NPI before that process can begin. The second step is to complete the appropriate Medicare enrollment application. And the third step to becoming a Medicare Part B mental health provider is to work with the MAC to successfully complete the entire enrollment process. Let's talk about getting that NPI, that first step. NPIs are not issued by WPS. They are issued through the National Plan and Provider Enumeration System. We call that NPES. If you're not sure if you already have an NPI, you can check the NPI registry that's available online. I've embedded a link to it here on this slide. You can use the NPES website to apply for an NPI. The link is here, as I mentioned it, both to that searchable registry that I talked about to check to see if you have an NPI and to the website. I've also linked on this slide to an NPI fact sheet with even more helpful information. Let's talk a little bit more about that second step, that completing the Medicare enrollment application. And this webinar, as I mentioned, is really designed as an introduction to these topics today. So we don't delve into the enrollment process itself, but this provides you with the information you need to begin that process. You need to complete the appropriate application, and the quickest way to do so is to enroll to use CMS's online provider enrollment chain and ownership system. We call that PAYCOS. You might have noticed I'm using a lot of acronyms today. Medicare has tons of them, and we actually have, and I'm going to show you where to find this, we have an acronym list out on the WPS website. I don't always put this into my presentation because we have it right here on our website. I'm just trying to pull it open. Struggling with that reaction time today, but here it is. This is the homepage of the WPS website, and you can see up here within the URL, our website address is https://www.wpsgha.com. And Karen, I'll have you throw that into the chat if you would, please. But if you scroll to the bottom of any WPS webpage, you're going to see large blue box, and under the first column that's titled Need Help, there is an acronyms list. So if you ever hear someone mention an acronym and you don't know what it means in the Medicare world, you can come out to this handy list to see if you can find it here on this list. We also have this nice filter capability to use so that you can quickly search for something if you have a keyword or something that you'd like to use when looking for an acronym. So some good helpful information there. Back over to our PowerPoint here. You do need to complete the online provider enrollment chain and ownership system. We call it PAYCOS. But if you don't care to use the online system, which is really the most efficient way and the quickest way to enroll, the paper option is still also available. There is help for enrolling in the form of an online PAYCOS enrollment tutorial and a PAYCOS fact sheet. I've linked to both of those here on this slide. These are CMS products, but WPS also offers a lot of enrollment related education, including more than 50 YouTube videos on our YouTube channel's provider enrollment playlist. For those that choose not to use that online enrollment system, remember that the paper option is also available. It just takes a bit longer. Here's some information that I've included for you to come back to if you are one of those individuals that is involved with credentialing at your place of work. This is a slide with a link to that WPS YouTube provider enrollment playlist that I mentioned, over 50 webinars, or recordings, rather, videos. There's also a link to our provider enrollment guides and resources webpage, and it is on that webpage that you will find instructions for those wishing not to use online PAYCOS. It will also link you to the instructions for using online PAYCOS. So a lot of great information out there on the website. I might also add that if you are looking at our website, and I know you do because you registered for this webinar, going out to it here, pulling it over, make it a little bigger so you can see it. Bear with me. All right, let me move that up here. On the WPS website, any web page, at the top of the web page, any web page that you're on, you will find the training center. If you look under the training center and choose here, live events, this is where you can find the list of our upcoming events. And you very likely have already seen this page because you registered for today's webinar. But if you just used a link from one of our eNews news notifications, I wanted to show you this so you can come back to it. This is where you will find that list of upcoming events. And what I want to mention here and make a plug for are some of the many live webinars that we offer, assist those that are working on a provider enrollment process. So there is many webinars that some of my counterparts offer, and they take you through the process of the enrollment process and filling out those forms and such. So some great information to have. I want to talk a little bit about provider specialty codes. Upon successful enrollment in Medicare, a provider specialty code is assigned to that newly enrolled provider. CMS does maintain a list, and it's available on their website. We also have a provider specialty code list on our website. There's a link provided here on this slide. Medical doctors and DOs, doctors of osteopathy, can self-designate their specialty or specialties, multiple specialties, during the enrollment process. However, non-physician practitioners who want to enroll with more than one specialty, they can do so, but they need to separately enroll for each specialty of their choosing. While some providers have a primary and a secondary specialty, some also have a tertiary specialty. And all of those can be reported to Medicare, and it's included in those Medicare eligibility files for the provider. I want to talk about use of those specialty codes, specifically during claim processing. Specialty codes are very important and are used during claim processing. It is only the primary designated specialty, the one assigned at the time of successful enrollment, that is used during initial claim processing. Now, Medicare doesn't use taxonomy codes for claim processing purposes. We get a lot of questions about taxonomy codes. They're in our records, but we don't use them for Medicare claim processing purposes. Now, during the edit and audit process for some claims, providers with more than one specialty may need to request an appeal if their service is initially denied, and then they would need to stipulate that they have that secondary specialty in order to be eligible to receive payment for some services. Now, this is just another example of why it's so important to know your specialty status and make timely changes to your enrollment record as needed. as needed or if needed. You need to make certain you keep those provider enrollment records up to date. Now, I've been talking about enrolling in Medicare. You need to enroll in Medicare in order to submit claims and receive payment from Medicare for the services, covered services that are rendered to Medicare beneficiaries. But there are some situations when an eligible provider chooses to opt out of Medicare, and instead the provider wants patients to pay out of pocket. To opt out of Medicare, there are certain rules to follow. They are listed here on this slide. You need to remember, though, that only certain provider types are eligible to opt out of Medicare. And to opt out, you need to submit an opt-out affidavit to your MAC, and you need to enter into private contracts with each and every Medicare patient you treat. Let's talk a little bit more about opting out. We get a lot of questions about that. This slide does include a link to our webpage that allows access to helpful information for opting out of Medicare enrollment. If it is your wish to opt out of Medicare enrollment, I do encourage you to review this information. I also suggest that you consider watching our YouTube videos that feature education about opting out. You can find these on the provider enrollment playlist that I referenced earlier in this presentation, and that link is embedded in your presentation materials or your handout. On to defining partial hospitalization program, or PHP, and community mental health center, or CMHC, services. This is the final portion of today's webinar presentation. On slide 23, you will find the definition for PHPs. These are distinct and structured intensive outpatient psychiatric care. It does include substance use disorder services, and these are through active treatment. And these happen by combining clinically recognized items and services. And for each, there is a plan tailored to each patient that is having services in a partial hospitalization program. They do, as I mentioned, follow those tailored plans to meet each patient's specific needs. And this, of course, would be part of that documentation that's maintained in the patient's permanent medical record. This information must be available should Medicare request it. Based on CMS guidelines, PHPs offer psychiatric treatment that is less than 24 hours a day. The expectation is that these would be patients discharged from an inpatient hospital treatment program, and then the PHP replaces the continued inpatient treatment. That means that your records must show or must demonstrate that the patient would be at reasonable inpatient hospitalization risk without these services or without the partial hospitalization program. Here is a list of what services or some of the services that are included in PHP services. You can see your individual group therapy, occupational therapy would be included, family counseling, only when the primary purpose, of course, is the treatment of the patient's condition, and even more. We're just scratching the surface on this entry-level introduction today, but there is additional information about PHP services that you can find using some resources I'm going to mention in just a little bit here. This slide explains that there are two parts to Medicare's reimbursement for PHP services. Medicare Part A pays for the facility charges, and Medicare Part B pays for the professional services for those patients in PHP programs. The patients in PHP programs are responsible for any unmet Part B deductible or deductibles, the 20% coinsurance for the professional services, that's the Part service, and then of course a coinsurance for each day the facility charges for their services. That would be that coinsurance for the Part A services. So beneficiary responsibilities here for PHP programs. And here is where you can find that more in-depth information about PHP programs. Today's presentation, this entry-level presentation, is really designed just to define PHP programs and CMHC services. So I've included a link here on this slide to the Code of Federal Regulation, and it does include conditions and exclusions for PHP services should you be looking for more in-depth information on PHP. So on to community mental health centers. CMHCs provide outpatient services for residents in their service area who are discharged from an inpatient mental health treatment facility. CMHCs are required to have 24-hour emergency services with clinician access, and they may also have day treatment and PHP services. Their structured treatment plans would vary in intensity, frequency, duration, all depending on the needs of the patient. There are Medicare requirements for both state and local CMHC, I can't say that today, CMHC licensing or certification. Additionally, 40% of the CMHC's services must be for patients who are ineligible for Medicare benefits. So another requirement there specific to CMHCs. Similar to the information that I've made available to you for PHP services, here is information. You can find the conditions of participation, organization, and so on and so forth for CMHCs in this embedded link to the Code of Federal Regulations. I want to show you a change that we recently made out on our website. And the reason why I made this change, I'm going to go to our homepage. The reason why I made this change is because I received some feedback in some surveys, one similar to the one that we're going to ask you to take following today's presentation. And they said they wanted a place on the WPS website where they can find mental health information. You probably noticed today within the presentation that I've embedded links to a lot of resources. We have the Code of Federal Regulations, we have CMS, we have some information on our website. Of course, we have our local coverage determination. That's our local policy, applies only to WPS providers. We will be covering that policy in an upcoming webinar that's scheduled for initially is going to be hosted by Karen on February 22nd. And assignment, among other things. If you go to the training center, remember, out under our live events webpage, you can see those upcoming surveys. So the next one in this series is Karen's on the 22nd. You'll notice that each of the webinars in this series of 12 webinars, begins with mental health playbook. So that's kind of some keywords you want to look at. And here's information that you can find about registering for that upcoming event that Karen will be presenting on the 22nd. Assignment, provider qualifications, and payment. We get a lot of questions about the provider qualifications, and qualifications are one of those things that are vetted during the enrollment process, but we'll show you where you can go to find all of that great information. In addition to these webinars that you see on our live events webpage, you can see that we currently post out through March 12th. We go about 6 weeks in advance. We get quite a lengthy list of all of the offerings that we have, our provider outreach and education staff offers. So to add all of that information out through the end of this series, which ends in June, would be quite a long list. So you can see, you'll need to pop out here every now and then to see the mental health playbook series webinars that are being scheduled. There's about 2 every month through June. So I did want to point that out to you today so that you can come back to it. But I talked about that survey, and then I kind of got distracted, so I'm sorry for doing that. But I do want to show you where on the website. I pulled it away and didn't need to. I'm going to go to the home page, just simply because that's a great site. For those of you that are new, you're with our website, we do hold week or monthly demonstrations of our website to show you the various topic centers. There's several of them. Website, but you can find some links to some great mental health resources all in one place on our website by going to the training center, the top of the page, scrolling down, and then choosing specialty service training and resources. You choose that link, it opens up several specialties or specific areas of Medicare coverage where we provide training and resources. And outpatient mental health resources is listed right here. And this is what I recently added to guides and resources here under this portion of the training center. I have many links to a lot of great information that pertains to outpatient mental health. So I've included all of those for you, and you can open any of these just simply by clicking on the link. You can see that I've even added some links to our modifier fact sheets out on our website. So some great information. And for those of you that work with those folks within your organizations or offices that work with the patients, I've even included some information here or a link to some information for patients that you might find helpful in explaining rules and guidelines for Medicare payment to your patients. So just something to think about there. All right, I'm going to pause for just a moment, take a drink of water. So here then is a list of what I've covered during today's presentation. Exactly what I told you I was going to cover in that description for today's webinar. We talked about what mental health services Medicare does cover and what it doesn't cover, how to become a Medicare mental health provider, those 3 steps. And then an overview of PHP and CMHC services and really kind of a description of what they are and how Medicare pays for those services. Here on this slide, you can see there is a link embedded to that live events webpage that I showed you, that webpage where you can sign or view descriptions for upcoming events and sign up for them. And of course, there's other sessions in this mental health playbook series that are coming up soon, and they will continue through June. So at this point, I am going to open for questions, any questions that we've received in the chat that pertain to these bulleted items here over in the left column. Karen, are there any questions that pertain to content for today's webinar?
Hi, Mary. Thanks for all that great information. I did want to share one question that I answered privately about the effective date once you're notified that the provider application was approved. The effective date for on your provider application, it can be you'll receive a notification letter, so it can be found there. Also, if you have access to PAYCOS, you would be able to find that in your enrollment record. And also another option would be to customer service. So I thought that might be something that'd be helpful for everybody. So I wanted to share that.
Oh, I agree. Just to
go ahead. No, go ahead.
I was just going to show where you can find those great provider enrollment resources. If you're on the WPS website and you come to the topic center and choose provider enrollment, you can scroll down, you can view by topic, specialty services, and then you can also choose to view A through Z, expand that. So a lot of great information out here. I tend to stick with the topic. I like to use topic, and then sometimes I use this filter here to find additional information, such as I just typed the word opt in the search box, and right there is the opt-out information. Back to you, Karen. Are there more questions for today's topics?
We did have another question. When you were talking about the payment for PHP services, we got a question that asked if the per diem was billed on the hospital side or the professional side.
That's a great question. Thanks for sending that into the chat. The actual Facility services are billed to Part A, and they're paid under Part A guidelines. Okay, great question. Only the professional services are billable to Part B and reimbursable under Part B. That's why we have the deductibles that that a patient's responsible for. They're responsible for 20% of those professional services. That's that Part B claim. And then, of course, there's the coinsurance for the daily facility rates, reimbursable under Part A. So good question.
And that was all we had, Mary.
All right. Is there anything that any of you listening in today or learning about today needs to see or wants to find on our website that pertains to mental health, something that I could perhaps help with? Just throwing that out there. Sometimes it's a good idea to take a look or to help find information that you may have looked for in the past and you weren't able to find. Keeping in mind, of course, that there's a lot of information on CMS's website. Just something to think about. You can throw that in there too if there's something that you're looking for that you can't find. I do want to make mention of something that popped up last evening when I was looking on my phone at Facebook specifically. I do subscribe to WPS's provider Facebook page. Some of you might not know that we have a provider Facebook page, but we do. And there's that's kind of a nice way to stay on top of news while it's news. If you're interested in our provider Facebook page, I'm going to show you where you can start that process of following us on Facebook. You could come out to the WPS website on any page, and you can come down here under Stay Connected over here on the right side. You'll see me moving my cursor, and then choose here, click on that Facebook icon, that F. To get the ball rolling and subscribe to our news. The big news last night was just something that I've been talking about lately. I've been monitoring the education mailbox. That is that mailbox that Karen has placed, or that email address rather, that Karen has placed into the chat feature a couple of times today, at least a couple of times. It's wps.gha.education@wpsic.com. I've received a few questions coming into that mailbox that pertain to the 2026 physician fee schedule. We did publish that yesterday. We have to wait for that fee schedule to be delivered to us from CMS, and then we tweak it and spot check it and place it out on our website. So if you're looking for the 2026 fee schedule, you can come out. There's news always pops up here. You can move from, we call this our carousel. That's important news. I'm just clicking on this arrow down here to move. And right there, the 2026 fee schedules are available. A lot of providers have been asking for those. So hot topic, you can read more about it by clicking on the read more button. This will link you to those 2026 physician fee schedules, but you can also find fee schedules by coming up here to the topic center and then choosing fee schedules and reimbursement. And there, folks, are those links to the 2026, or the link to the 2026 physician fee schedule, and then to specialty pricing information, which does come into play for some of you folks. And I'm going to go ahead and click on that because of the clinical social worker pricing that's available. And basically, this just tells you that a clinical social worker is going to receive 75% of the physician fee schedule. There's more information here about nurse practitioner and physician assistants. They receive 85% of the physician fee schedule. And Karen and I will be talking about fee schedules and reimbursement in an upcoming webinar in this mental health playbook series. So just something to keep in mind. Karen, I'm going to come back to you and check if we've received any more questions.
Hi, Mary. We have not received any more questions.
Okay. Because we have time, I am going to just address one other topic that came up on the pre-submitted questions that some of you asked about, and that is telehealth. The telehealth guidelines, of course, are important for all providers, making certain that patients have access to care. And it's important for you as as mental health providers. Somehow I scrolled forward here. I should be on the questions and answers slide. It's important for all of you to recognize that you need to be careful when you're reading about Medicare's guidelines for telehealth, because telehealth guidelines for mental health services and behavioral health services differ from all other telehealth for Medicare. So I want to make certain that you know that there's a difference. We do have an upcoming session scheduled for telehealth, but one really great way to stay on top of things, all things telehealth that is, including those extensions that keep getting extended. I like to call them Band-Aids because they keep getting placed on and they don't fix things. They just keep getting placed on and getting ripped off and placed on and getting ripped off. They keep the extensions just keep happening. This is a great website. It's telehealth.hhs.gov, and I want to highly recommend it to all of you. You can choose to look at information for providers. If you scroll down on this page, you can see there's guidelines for licensure, billing for telehealth. We get a lot of questions about what happens when you cross state lines for telehealth. Take a look at this. That'll help you. And telehealth policy, that's the important one. And I'm going to go back so you can see me click on it. It's right here. Telehealth policy. This is where you want to make certain you're following telehealth policy updates that talks about those Band-Aids, those extensions that are happening, and make certain that when you're reading this, you're recognizing when and when not it pertains to you when you're billing mental health services, okay? This talks about that inpatient or in-person visit for mental health services. It's not required through January 30th of this year, so down the pike, it's coming. And it talks about rural health clinics, federally qualified health centers. We didn't talk about those today, but we do get a lot of questions about them. So I wanted you to know about this this really great resource. I did host a webinar back on September 11th about telehealth. It's available on our YouTube channel, and I'll show you where you can find that. Now you can, put a bookmark in so that you come directly to WPS's YouTube channel. But sometimes when I'm working, I just simply we used to be known as GHA, so our YouTube channel is still listed on YouTube under GHA, but we are government services, no longer GHA, just a name change. If you go to our YouTube website, and I'm going to turn that off right now, because when you go to when you go to our YouTube page, our YouTube channel, that's what I want to say. You come out here, you can see the playlists. We do have a mental health playlist. You can search for that, brings it right up. You'll see some of those webinars that we've added to our mental health playlist. You can search videos out here, many of which are mental health, but you can find a lot of great information here. What I wanted to show you is that telehealth video. We have a telehealth playlist also right here. When I searched telehealth, the first result that came back is an overview of Medicare telehealth policy, past, present, and future. This talks about, what in the beginning, before COVID-19. It talked about policy during COVID, what changed. It talks about the waivers. It also talks about the future. At that time on 9/11, I could only speak to what was happening on that day. Since then, I have made I have published some information out on our website of where you can find updates to that telehealth policy, specific to that in-person visit requirements. So you can find that out on our website. But I just wanted to point this out for you. There's a lot of great information out on our YouTube channel. I do encourage you, if you've never looked at this, to take a look. If you watch a video, let us know if you have comments, if you have suggestions for future education, and so on and so forth. We would love to hear from you, and really that's what drives the changes that we in provider outreach and education are making. In just a few minutes, you are going to be able to complete a survey. You can begin it at any time. Actually, you can tell us what you liked, what we could do better, suggest topics for future education. I know I sent an email out to most of you who had registered as of Monday this week for today's webinar, explaining that we are talking about certain topics today, but we plan to talk about other topics in the future. I told you how you could get your questions answered if you have a question about something we're covering in the future. If you can't wait until we cover it in a future webinar, you can contact customer service and someone will help you immediately. But we really want your feedback. It is invaluable in ensuring that our education is timely and effective. There's different options for taking this survey. It depends on your preference, what you like. You can scan or you can use the link that Karen has placed into the chat. When you actually exit today's webinar, there's going to be a pop-up that will show like this white box up in the upper right corner that has the yellow triangle at the top. It is an email telling you we're taking you to the CMS Qualtrics website so you can complete the survey. It's not malicious or anything. If you haven't already completed the survey, you can click on that blue button to provide that survey and give us that feedback. Tell us what you want to learn about in the future. It doesn't have to be mental health. It could be anything. Tell us how we did today. Did you enjoy this customer experience? Would you recommend our education to others? That's probably the greatest compliment we can receive, is that you do recommend to others, or you do tell someone within your office or organization, hey, I listened to this great webinar, or I listened to a webinar, I learned a lot. You might want to listen to it, so on and so forth. So something to keep in mind. Please do provide that feedback in the survey. In a few minutes, you will receive an email and it's going to thank you for attending. If you are seeking continuing education units, I recommend that you don't delete it before reading it. The email contains verbiage that is or acts as your certificate of achievement. It's going to be an email that comes from WebEx. That's the platform we're using for today's webinar. So it's going to come from WebEx, not from WPS. For this reason, there might be some settings at your organization that won't allow emails from WebEx. So you might want to check your junk folder or your spam folder to see if it delivers there. If you don't see it, be sure to add that WebEx email address to your safe sender list. If you joined by telephone only, you need to listen up right now, because you will not receive the email certificate of achievement. Instead, you'll receive an email saying, sorry that we didn't see you today at the webinar, because WebEx doesn't have your telephone number information. They can't connect it to you, so they can't send you the email that says, thanks for attending, here's your certificate of achievement. So if you joined only by telephone, in other words, you're only listening to me speak today during this presentation, and you need CEU, send in an email request to wps.gha.education@wpsic.com. In that subject line, put mental health getting started, and we will make certain to send you an email that within that body of the email will have verbiage that acts as your certificate of achievement. Our certificates of achievement might sound like there's a certificate, but it's really verbiage within the email. It is that email that you need to send to an accrediting body of your choice to ask them to consider award of CEUs. At this time, I do want to thank you all for attending. We know that you're all incredibly busy. We do encourage you to provide feedback on the survey. We want to know what you liked and what you didn't like, what topics we can do in the future. Just as an FYI, we are planning another Medicare Education Expo. That is a single day of education with multiple events that you can register to attend. You don't have to register for all of them. You can pick and choose what you want to attend. It is on January 27th. We're going to provide details about the focus and responsibilities of various departments at WPS. We do have a theme that we've chosen. It is warm up to the WPS departments. We thought that would be apropos here in the midst of winter. Review our live events webpage to register for that or for any future events. And don't forget to view our encore playlists for past webinar recordings. On behalf of Provider Outreach and Education and Karen and myself, thank you for participating today. We do look forward to those survey comments, and we hope to have you join us for future events. You may now disconnect. Have a great day, everyone. Goodbye.